Now we have a very young patient and she does not have actually almost any signs of aging, but what we see in her is actually skin with large pores, some open and closed comedos, and also some small milia, especially on the cheeks, on the nose and the chin, and also some small inflammatory pimples and pustules. And in this case, that's the reason why I'm going to use the mask peel. First, we clean the skin with Foamer 15. 4 pumps. Applying on the whole face, especially in the areas that are looking a little bit more hyperkeratotic, and leave it for 1 to 2 minutes before removing it. Now we're going to remove it. You can dry it with cotton swabs or with a fan. Now we're going to apply the mask peel. That is a paste. You do not need too much. Just take a little bit. You can apply directly to the face, or you put it first on your one hand and then again starting with the T-zone and distribute it very evenly and slightly. Leave it for about 2 minutes. Then the rest of the material that you have, in order to distribute it a little bit more evenly, you could do it from the beginning as well, distribute on the face. And massage it also a little bit, especially, for example, nose or the chin, where we have some closed mid-tears and comedos and also some inflammatory dimplings. And in order to reduce the discomfort, you can also use a fan and cool down a little bit. And then remove it. Always away from the eyes. We can dry a little bit. And after we have dried, put some moisturizer, for example Hyaluronic, that will hydrate the skin, and due to the jojoba oil, a little bit anti-inflammatory and aloe vera as well. The patient should apply sun protection before going out. I usually have my Hyaluronic in the refrigerator, so when I apply it, it cools down immediately and even reduce the burning and stinging more than just the cream by itself. For the next time, what you could do, you could apply your mask peel everywhere except cheeks here, and then you would actually could leave it even a little bit longer and reducing the patient's discomfort. And in the patients who are having closed comedos or milia, it's much easier to open and to decapitate the milia, for example, with either the comedo extractor or a 30G needle after you have performed mask peel than without performing it before, and it's even a little bit easier than if you just do the vaporization.
possible with Health Canada are Phedia High Tissue PRP, which we will discuss today. And again, we are proud to say they are the 2023 winners of the Aesthetic Medicine's World Congress Award for Best Regenerative Care in PRP. So definitely, if the world thinks so, it's great for Canada. And our beautiful medical grade skincare lines, mesoaesthetic, that is committed to science from its ideas, formulations, and protocols made in science with science to back it up. Mesoaesthetic is there for you. And of course, our Dermaceutic laboratory, born from a collaboration of brilliant French dermatologists. Dermaceutic laboratory supports all your medical aesthetic treatments from pre-treat to post-care and maintenance, and will help you with all of your aesthetic concerns. And of course, here at Nuvior, we want to be your one-stop shop. So we offer thousands of medical supply SKUs to help you support your business. We do have our brilliant price match guaranteed. So please, if there is something that you require for your facility and don't see it on our website, just reach out to one of our Nuvior team members, and we will definitely do our best to make your needs satisfied. And of course, I'm Pina Lee, your clinical educator. I'm very proud to be with you today and share my knowledge and passion for all that is skin and all that Nuvior has to offer. So welcome again to our weekly webinar, where today we will be speaking about Phedia High Tissue PRP, elevating platelet-rich plasma technology here in Canada and around the world. Before I tell you how amazing and what a beautiful segment to your facility PRP high tissue would make, let's just discuss the basics. What is PRP? Well, PRP is an acronym for the word platelet-rich plasma. It is a treatment also known as an autologic conditioned plasma, where we take a portion of the blood called plasma that is rich with platelets. And these are proteins that are derived from that whole blood. We take the blood, we centrifuge it, which means we spin it in a special device and remove the different parts of the blood that we don't want to use in the treatment. Now, when we break down blood, and this is just basics, I'm not going to get too sciencey for you, so don't worry. But when we talk about the elements of blood, when it comes from the human body, 55% of that blood is plasma. It is a liquid that is basically the medium for all the different components for blood to move through our vascular system. And in that blood, there is also those platelets. And in the platelets, it's a very small amount. When you're talking the amount of platelets per milliliter of blood, we're looking at a range, because everyone is different, from 150 to 300 microliters per unit of 1 milliliter of blood. So that means in the whole of the blood, that essential platelet that we are striving for our PRP is quite unconcentrated. When you're talking about the amount of red blood cells that provides us our oxygen, that's about 41%. And then, of course, there's about 4% of that blood makeup that is your white blood cells. That is your 911, also your defense system. It gives us our immune system. It helps fight bacteria. So when you break down the elements of each of those functions, as I alluded to, your red blood cells, also known as RBCs, is where you're going to get that transportation of oxygen, bringing in fresh oxygen to the cells and taking away that waste product, that carbon dioxide from the cells and bringing it back to the lungs for more oxygen. And as I said, that small percentage of white blood cells really have their work cut up for you. They play that crucial role in that immune system. It is the first line responders when there is trauma or something has occurred in the skin and the skin is no longer intact or damaged. Your white blood cells come like 911. Then, of course, what we're looking for that lives in that plasma. Those platelets are responsible for clotting or coagulation of the blood when there is injury to those cells. When the injured cells are damaged, these platelets will clump together within that blood and they will prevent that excess bleeding so we don't bleed out. Those platelets is what is going to start that healing process. And the plasma, as I said, that's that medium. That's the liquid component of blood, and everything else are actual little particles. And it serves as that medium to transfer the rest of the blood through the body. So most of that is made of water, 90% of it. And the total amount of that plasma is 55% of that total blood. So when we're talking about the important things of PRP, we are primarily concerned with that plasma and in particular the platelets. So our goal in PRP is to separate these two elements from that rest of the blood and make it as pure as possible. And that process is called centrifugation. So we are going to take that concentrated amount of platelets, which gives us a concentrated amount of growth factors. And this is what we are looking for in the medical aesthetics as well as the medical world to help stimulate that healing process, speed up and accelerate that damaged area into healing so we can decrease the pain factor, as well, in other cases, encourage growth of hair. And of course, for rejuvenation, stimulating those fibroblasts to create collagen and elastin. Now, PRP is not new, but it has been forecasted that it is going to grow by 11.2% within the next 10 years. And the American Society of Plastic Surgeons also see that this is a great opportunity to dramatically improve skin with cosmetic PRP. Now, when it comes to application, PRP is beautiful for the body. Because it's coming from its own body, you will have less risk of reactions. It's coming from their own blood. So it's going to be a wonderful tool to stimulate that collagen and elastin production, which is going to in turn improve skin texture, reducing fine lines and wrinkles, restoring that firmness and elasticity of the skin. And for scar treatments, whether they were brought on by surgical or by a skin infection or a disorder like acne, this is a beautiful way to help that body heal faster and without visible scarring. And of course, for just overall tone and to address pigmentation concerns, PRP is a fabulous tool. When it comes to hair restoration, PRP can successfully be used to stimulate hair follicles, promoting hair growth for those with thinning hair or any androgen alopecia-induced conditions. It strengthens the existing hair follicles so you can provide your patient or client with a fuller and thicker head of hair. And for those more intimate areas, when it comes to vaginal rejuvenation, PRP is becoming a bigger trend. It helps with the improvement of lubrication and alleviating that vaginal dryness and discomfort that so many women suffer from later in life, as well from childbirth or menopause or any other female conditions that bring on that uncomfortable feeling in that area, or if enhancement of tightening is required to retone and make you feel better, this is a beautiful option. So who is Fidia? Well, Fidia is a fabulous company that is just a powerhouse when it comes to the medical world, around the globe. It was founded in 1946 in Italy, and now it is just diversified incredibly over this last few years. In 1987, they combined forces with a beautiful company, and now they can serve over 20 million patients for their intra-articular injections for therapy of osteoarthritis. And now, in the last year, Fidia High Tissue PRP's offices have been moved to the beautiful Barcelona, Spain. And Fidia itself owns affiliations and commercial partners in over 100 countries around the world. And their external earnings from overseas is over 371 million euros by 2021. Which shows you what a beautiful reach they have around the world to bring you the best, whatever they offer. And one of the major focuses of Fidia is joint care. Their joint care with their beautiful hyaluronic acids and their beautiful injectables is where Fidia is basically known for around the world. They do eye care, and now they're getting into that aesthetics world, and why their high tissue PRP is one of the most reputable ones and trusted because it has been used in that medical spectrum for a very long time. But why go with Fidia? Well, the reason is clear. Fidia, before they launched their PRP, they wanted to understand the common concerns with existing PRP systems already out there. They wanted to ensure that when they launched their high tissue, that it would give you everything as a practitioner that you would require to provide your patients with the proper care. And the first thing that they address, in no particular order, is the majority of systems out there have a greater chance of human error, whether it's from the extraction or the collecting process. There is a higher risk of contamination. And when you are talking about a pure system from the body, you want to make sure that it's as pure as possible, especially if you do want to use it for injecting into the body. And of course, it's always about the purity. It's very common in existing devices to have a high risk of tainting from those red blood cells and white blood cells that we have tried so hard to separate the platelets from. And of course, many systems are very cumbersome with many steps, with accuracy to be accomplished in those steps, or the whole system will break down. And of course, one of the most important reasons for Fidia to enter is to ensure the high level of platelet concentration. With many of the devices out there, when tested, there is low concentration of those platelets. When you're talking purity of PRP, PRP is when it is above the baseline, which means at that normal amount of platelets in the blood. But when there's such a low amount of platelets in whole blood, PRP, when you're talking in numbers, it could mean a wide variety. But when you are providing care for your patients, FIDIA wants to ensure that you give them the most highest amount of PRP available. And that is what we deliver. With FIDIA's high tissue PRP breakthrough, they have designed and patented technology that facilitates and enhances the concentration of those platelets within that plasma. Platelet-rich plasma, or PRP, from FIDIA will contain a concentration of up to 99% of platelets in that PRP. And I get so excited just telling people about that because it gives you the high levels of platelet concentration is exactly what we're sought after when we are trying to get that rejuvenating and therapeutic properties. When you do compare and look at the quality of the PRP, when you use our 20 ml system, you are going to draw the blood and you will notice that you will get up to 8.8 or higher mLs of that PRP with such a low count of white blood cells, less than that 1%. So that means that your platelet factor, your concentration factor is up to 2.9. Great for skin and rejuvenation and hair concerns, giving you 6.8 billion platelets in your 20 ml tube, which is absolutely amazing numbers. And how does FIDIA make this possible? Well, it does this with their mind-blowing patent technologies. And there's 3 of them. Our push-out precise selection technology, our cells motion, the motion that cares technology, and our nanostatic protective surface technology. Now, I'm so excited that the best part for me is everything is one box. This makes ordering and warehousing and inventory nightmares go away because every box, one box for each client. It's all disposable, it's all self-contained, and everything you need for your client is right there. So in each box is 2 comprehensive kits. Your first one is your extraction kit for harvesting the blood from your patient. And then you have your second kit within that box that gives you your PRP kit for distinguishing the different amounts and extracting exactly what you need. It is adaptable for any procedure. It is compact and it is complete. Now, our advanced technology, it's a cutting edge system. And our push out system is for precision. It has a laminar flow, which means all you do is push down for precise PRP selection directly from the tube to the application syringe without platelet activation. And when it comes to the design, this is where FIDIA high tissue PRP stands out. The first thing I want to make you aware of is our self-sealing filter here at the bottom. This acts pretty much like a gatekeeper during that whole PRP procedure. And what I mean by gatekeeper, it's like your security system. It's going to block out that unwanted components of that blood, like your red blood cells and your white blood cells. But not only that, this filtering system has been designed to prevent flow back and contamination of your plasma. As well, it is going to maintain the purity and the effectiveness of those platelets for your PRP. It ensures that all platelets and those growth factors enter into that final product. Our self-sealing connector is also a beautiful addition to this technology. It is a vital link between those different parts of that Fidia PRP system. It enables a seamless transfer. So it's like a locking mechanism. So I like to think about it when you're watching those sci-fi movies or even going into a clean room. One door opens, you enter, that door closes, you then open that next door. It's the same thing for our PRP collection and processing system. This is a self-locking mechanism that ensures that it is closed throughout the entire process of collecting and administering your PRP. It also is designed for maximum security and it has a leak-proof connection. So you definitely have your closed system assurance with all these vital self-sealing connectors and filters. But the best part, it's ease of use. The push-out system has so many benefits, from safety to reducing handling, minimizing the errors and contamination risk from humans, because let's face it, we are only human. And it makes it much more efficient. It's a streamlined workflow. As you can see, there's very little manipulation. It's just one smooth motion pushing down on that syringe and extracting all of that blood into one smooth motion into our centrifuging tube. It ensures closed system consistency and predictability. And not only that, with our push-out system, you can also customize. So as you can see, once that product has been centrifuged, you now have that brilliant, beautiful plasma at the surface, and now the magic happens. You use our push-out system, lock in your syringe, and just push down. This allows you precise selection of which of the PRP area you want, whether it's poor or rich. And with our embolism design of a concave pattern, this allows to reduce that human error. All you do is gently push down in one motion till you get to that buffing layer and stop. That concave design will prevent contamination from any unwanted particles like your red blood cells. Easy to use, convenient, and above all, safe, providing the best concentration available. And it doesn't just stop with our actual tubes and syringes. Our technology and patents continue with our centrifuge device. With its cell motion patent technology, this is an exclusive soft centrifuging technology, which allows that centrifuge to optimize platelet and cell separation with high concentration and preventing the damage and preserving the integrity and viability of those platelets. So it's one thing to be able to retrieve that blood and retrieve that platelets, but if your system is very harsh and just torments those poor little cells, that platelet is not going to be able to do what you want it to do in its treatment. So with our cell motion technology, it gives you that right amount of spin and keeping those cells viable. And of course, I would not do it justice without mentioning our nanostatic protective surface. This device is made with an anti-electrostatic medical grade polymer with a non-polish coated surface. What does that mean for you? That means that those precious and sought after platelets will not adhere to your tube. There is no gel to adhere to, no plastics that it will adhere to, which means that you will increase your platelet recovery and ensure that your client gets the best of that blood that they've provided. So what does Phedia give to you? It gives you improved concentration. Phedia realized that PRP products require a higher platelet concentration that is currently available on the market today, especially here in Canada. With those cutting edge methods, we maintain high concentration with a greater effectiveness and efficiency over all other PRP procedures. It makes it user friendly. It minimizes that need of needle operations with its design and its push down system, reducing that risk of contamination and improving PRP safety for your staff. And of course, it's an all-in-one, easy to use disposable system, simplifying your PRP experience right from inventory to application. So to explain again in a nutshell, that Phedia Advantage, it's a seamless process which is safe and user-friendly. It's completely closed, keeping it pure and eliminating risk of contamination. Its unique formulation provides that superior platelet concentration with the bioactivities of your growth factors. And of course, it comes from a reputable company with a legacy and solid clinical background. And of course, the most important, it is Health Canada approved. So take advantage of that great market that we are going to expect by 2031, that 11% growth in that PRP market. It's going to give you a tremendous opportunity. And with our Phedia PRP technology, it is going to streamline that collection process. It's going to make that selection for you as that practitioner easier. And it, in the end, provides high concentration of PRP. Thank you so much for joining us as we discuss our award-winning high tissue PRP by Phedia. And as a token for joining us, for all those who have joined us, please go to our website, interact with our website. You can send messages, you can look up some beautiful information, and of course, fill out our survey and tell us what you thought of your experience. Give us information that you would like to know about and when best to serve you. And then you will receive your beautiful promotion to help you with your next order. And for those who have attended today, if you are an employee or own a clinic, please, we want you to know that here at Nuvior, you are part of our family. So as a Nuvior clinic partner employee, you can have your own personal Nuvior account. So just scan that code, go to our website, log in with your personal email, and you can then let one of our Nuvior teams know that you've registered, will approve you so you can receive below clinic pricing for retail products for you to try and fall in love with. Again, I'm Tina Lee, your clinical educator here at Nuvior. You can reach me by phone or text at 647-660-6999 or drop me an email at education@nuvior.com. We here at Nuvior are here to support you in any way we can. And before we go, I just want to open up the floor. If you have any questions about today's presentations, please ask here in the chat, and I will be happy to answer. Let's go to the line and see if there's any questions. I'll just put up that code. Again, no questions? Okay, thank you. Well, it's come to another end of our weekly webinar here at New Viewer. I want to thank you for joining us, and please stay tuned in next week, every Monday at noon, where New Viewer brings you something more to learn about. Have a great Monday, everyone.